Today we'll be discussing characteristics of well-constructed treatment goals. So these are the characteristics that your therapeutic goals should have in order to make them most beneficial for your clients. First, your goals should be salutary, not remedial. So the goals should be something that are beneficial for your clients, not simply goals that seek to correct a problem. So they should represent the presence of something positive rather than simply the absence of something negative. So in your goals, you want to describe what the client will be doing rather than what they will not be doing. So if your client comes to you and they state their goals in terms of what they will not be doing, ask them to restate their goals in terms of what they will be doing instead of that. So if your client has a goal of, I won't be so isolated, that's a remedial goal. That's a goal that seeks to only correct something that's wrong. You want to have them state that in positive terms. What will they be doing instead? So, for example, I will go out with friends at least once a week. I will talk to my family on the phone at least twice a week. So, what they will be doing. If your client comes to you with the goal of, I want to stop smoking, you can have them restate that in terms of, when I get stressed, I will go out for a jog rather than smoking a cigarette. So you want to not only correct the problematic behavior, but replace that behavior with something that is beneficial for the client. So you want them to have approach goals rather than avoidance goals. What do they want to do? What do they want to approach or move toward, as opposed to only what do they want to move away from and avoid? You'll want your goals to be new and different. Like we touched upon last week, you'll want to make sure that when you develop your interventions, you're not trying something that the client has tried before. They should be new, they should be different. The interventions and the goals should seek to break repetitive patterns and failed attempts and usher in new, more functional patterns of behavior. The goals should be process oriented, not static. So they should reflect the fact that there will have to be maintenance and continuity of preferred outcomes rather than a once and for all achievement. So consider the terms, I'm recovering or I'm in recovery versus I've recovered. So you want to make sure that your goals indicate that this is not an endpoint that you reach and you're there forever, but there's going to be continual maintenance of these goals. You'll want your goals to be realistic and achievable. So things that your client can realistically do and things that are within the client's control. So you want to make sure that you state goals in terms of things that your client can have control over. Your goals shouldn't be things like changing other people's behavior. I will make my partner more affectionate. That's not something that your client has control over. So maybe something like, I will be more, I will communicate with my partner more when I need affection. So again, you can't say I'll make my partner more affectionate, but your client can say I will communicate to my partner my need for greater affection, something that's within their control. Your goals need to be specific and comprehensible. So they should be specific and behaviorally defined. Your client needs to know exactly what behaviors they are expected to demonstrate in order to meet these goals. And the goals should match the client's language. So make sure that the client is stating goals in language that they understand and language that accurately reflects what they hope to achieve. The goal should be compelling and useful. So the client should feel that the goal is worth achieving. So that is part of the reason why you want to make sure that you're working collaboratively with the client to develop these goals, because they're going to have to be emotionally compelled to work toward these goals, and they need to feel like the goals are worthy of their investment. If you have sort of imposed a goal upon them and then you're asking them to work toward this goal that you've decided, they're not going to be very compelled or very motivated to work toward that goal. So the goal should reflect their values and preferences. And these goals should also be interpersonally related. So of course, your primary beneficiary of the change will be the client, but also people other than the client, people who are relevant in the client's life should notice some change in them. So all your changes or all your goals should not be things that are purely internal to the client and things that only the client will benefit from or be able to observe. People around them should recognize that there has been some change in the client. And finally, your goals should involve hard work. It should be a challenge to the clients, and it should reflect the fact that they're going to have to invest hard work in order for these goals to be realized. And the client should see the direct connection between his or her efforts and positive outcomes. So your clients are much more likely to value these goals and value the accomplishment of these goals if they recognize that they've had to work and they've had to invest themselves and they've had to really be dedicated in pursuing these goals.